Medical teams from the federal government are heading to Minnesota, where coronavirus cases are spiking. The state's health department reported nearly 5,000 new cases and 32 additional deaths on Thursday. The state's 7-day rolling average of new cases is over 10%, the highest in the country. Now Minnesota is looking to expand booster eligibility to all adults as soon as this week. Liz Collin from our Minneapolis station WCCO has more.
It's unprecedented. I have never seen so many people on a ventilator at one time.
Dr. Joshua Hilster is a critical care physician at Abbott Northwestern Hospital in Minneapolis. His ICU is full. The hospital system has nearly 330 COVID patients. Most of the 66 ICU COVID patients are on ventilators.
What's behind this rise?
Without a doubt, it's the lack of vaccination. The vast majority of patients that we see in the ICU are not vaccinated.
COVID cases in Minnesota are up nearly 50% in the last week compared to the week before. Hospital admissions increased 24%, with the largest increase among those 30 to 49. Susan Rutten spent a week in a rural Minnesota hospital. She is unvaccinated.
I feel bad taking up a bed if somebody needs it worse than I do.
She's now home and plans to be vaccinated. Tonight, as cases rise nationwide, CBS News has learned the FDA is considering authorizing boosters for all adults for both Pfizer and Moderna as soon as today. But 31% of the country is still unvaccinated.
What will happen if people remain resistant to be vaccinated?
The message has to be loud and clear. You can't run out the game clock on this one. This virus will find you.
How you doing?
Back in the ICU, Dr. Hilster worries about the toll more COVID cases will take, not only on patients, but on the staff that care for them.
I'm not angry at people who don't get vaccinated. Some of my colleagues get very angry about it. I'm not angry about it. I'm disappointed.
This hospital has more beds to care for more people, but not enough staff, and it could get worse. Dr. Anthony Fauci says there's been an uptick in the number of hospitalizations among vaccinated people who have yet to be boosted. And this hospital already has longer ER wait times. Lana?
Liz, thank you. For more, I want to bring in Dr. Hilary Fairbrother. She is an emergency medicine physician and a friend of the show. It's good to have you back on, Doctor. As we heard, the FDA could soon authorize boosters for all adults for both Pfizer and Moderna. Dr. Anthony Fauci said this week that hospitalizations are rising among people who have been vaccinated but not boosted. So how important is getting this extra dose right now? Could we risk threatening our progress against this virus? And who now should really be thinking about getting boosted? I think that there's a lot of people who are maybe back in the workplace, but don't necessarily have underlying conditions that are trying to decide if they should be going.
Well, so the booster it's on everyone's mind right now, especially anyone who's been vaccinated and hasn't had a booster shot yet. So I would say I expect the FDA and the CDC on Friday to say that anybody 18 and older who's more than 6 months out from their second shot is going to be eligible for a booster. We already know that everyone, the 15 million Americans who got the J&J shot, need a booster. And I think what we're seeing is that it is true that the immunity that the vaccine gives, it wanes over time, and Delta is a really infectious virus. It really is great at getting people infected. So even with the vaccine, people can still get COVID. So the booster certainly decreases the odds of getting COVID, and it decreases the odds of getting hospitalized or seriously ill with COVID. It is still exceedingly rare to get sick with COVID if you are fully vaccinated, and it is still almost impossible to die of COVID if you are fully vaccinated. I don't want to be unclear about that. But I think Friday we're going to see that everybody 18 and older who's 6 months or more out from their second shot is going to be eligible for a booster. And I would encourage people to go get boosted and really improve their immunity to this thing right now.
And let's talk about what's going on in your state. A report from the Texas Department of State Health Services revealed that unvaccinated Texans are 40 times as likely to die of COVID than those who are fully vaccinated. Texas falls below the national vaccination rate. What are you seeing on the front lines?
You know, my heart breaks every time I take care of someone who's seriously ill with this virus. And I always ask, if people are vaccinated, it does change people's prognosis. If a patient in front of me is unvaccinated, there's a higher likelihood of them being severely ill. So I always ask, and my heart breaks every single time I hear someone tell me that they've chosen not to be vaccinated, and now they're in front of me in the hospital, struggling to breathe, very sick, waiting to be admitted to the hospital or waiting to be admitted to the ICU. And I really just, I hope that we are maybe reaching some people who have been resistant to the vaccine thus far and really getting to a point where some of them might consider getting vaccinated. I have to tell you, most of the people who I take care of after they've been sick ask me about the vaccine, and I really, really wish that the two things were switched.
Yeah. So the people who then got really sick, hadn't been vaccinated afterwards, you're seeing them more likely to want to get vaccinated then as a result, and also to share that message with the people that they care about?
Yes. And I find that very moving and yet very heartbreaking, because I wish that it had been reversed. I wish people had been vaccinated so that they weren't in front of me very sick and getting admitted to the hospital.
All right. Dr. Hilary Fairbrother, thank you for being on our air, and thank you for all that you do.